Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Carbamates. Carbamates. Treatment of carbamates is atropine is the specific antidote for carbamates. Oximes are contraindicated because oximes combine with carbamates to produce carbamylated oximes, which are most potent cholinesterase inhibitors. Carbamates are in turn cholinesterase inhibitors, and this will aggravate the symptoms. So oximes are contraindicated with carbamate poisoning, and atropine is the drug of choice or specific antidote for carbamate poisoning.
thank you and thank you for watching.